Good evening and welcome to another insightful session from HT Spotlight. Today's discussion on managing your family's health in the pandemic is all about keeping yourself healthy, especially with the onset of the monsoon, which brings with it all kinds of seasonal diseases. Today we have with us Dr. Aditi Govitrikar, an actor and Mrs. World, who's also a qualified medical doctor and psychologist, and Dr. Hemant P. Thakur, consultant physician and cardiometabolic specialist, who's attached to several premier hospitals in Mumbai, including Jaslok, Breach Candy, and Reliance HN Hospital. Now, as we brace ourselves to get back to work after the second wave of the pandemic, staying in good health is, of course, top priority for everyone. And this time is all more tricky for those living with chronic conditions such as diabetes, heart disease, and asthma, who then become susceptible to serious infections. So today's discussion will focus on the precautions you can take to keep yourself and your family protected from seasonal infections during the pandemic. I'd also take this opportunity to thank Sanofi Pasteur, the world leader in vaccines for both children and adults, for bringing us together in this conversation and clearing the air about some of these critical issues. So let's start the discussion. Aditi, great to have you with us. You wear many hats. You wear many hats: an actor, psychologist, a doctor, and also a mother and a daughter. So how are you maintaining the health of your family during the pandemic, and what are the additional steps that you're taking to ensure that kids and adults stay safe?
Thank you, Gautam, for the kind introduction, and hello, everybody. And like you rightly said, clearing the air has become a crucial point in our lives right now. Well, I did get vaccinated at the right time, which was the most important thing. In addition, I also made sure that whenever we step out, all the family members, we double mask ourselves and make sure that we wash our hands every time we come in. So we are taking the basic precautions, of course. The parcels are getting sanitized the minute they come home. In addition, I have included immunity boosting foods in my diet, plus a few supplements. And since, I am a psychologist and I am a Vipassana meditator, anxiety being so high everywhere, including the children, I have made sure that we have included a meditation hour in our lives. So we might not necessarily meditate for 1 hour, but at least for 15 to 20 minutes every day. All three of us sit together and we meditate. And these are the basic things that I have incorporated in my daily life, in the routine, so that I protect myself and my family members from the evils of Corona.
Fantastic. You could say it's a 360-degree approach. You're taking care of the mind and the body as well. Dr. Thakur, coming to you, many adults do suffer from chronic diseases and lifestyle disorders like diabetes, high BP, heart disease, and asthma. So what are the long-term implications of these disorders on health in general? For instance, we know that prolonged diabetes can lead to kidney malfunction.
So I think, Dr. Aditi has already told you the 360-degree view of what people have now been WhatsApping, Googling, discussing everything for the last 18 months. As a medical man, what I really want to tell you is that everybody, as we age, as we grow, and aging starts at the age of 30, 35, in cities, in countries where there is a lot of stress, you're going to have chronic diseases, lifestyle diseases creeping in. And especially what you mentioned, diabetes. Diabetes is a lifestyle disorder which wakes up a genetic condition for poor sugar control. And anybody with poor sugar control becomes susceptible, has a weakened immune system to fight infection. And when your sugars are high, especially when they are uncontrolled, you're likely to develop infections easily, to pick them up easily, and to eradicate them will be extremely difficult if your sugars are low. So the diabetic or the patient with lifestyle diseases, which is hypertension, hypercholesterolemia, and other lifestyle problems, they're all going to find it difficult to shrug off infection. Whether it's a viral infection, bacterial infection, their immunity is low. The high sugar values do not allow the bacterial or viral response in the body. So all people with lifestyle diseases have to pull up their socks, bring everything under control, and be a little more alert and do much more than what Dr. Govitrikar said, because they are susceptible, they are liable. And if they don't look after themselves, they will be the first targets.
Got it.
Absolutely, the vulnerable category definitely needs to take care of these kind of issues a lot more. And given that there is the monsoon season which is ongoing right now, do you feel, Dr. Hemant, that adults and children should up their guard since chances of acquiring seasonal infections are high?
Absolutely right. You have an environmental downpour, an environmental change during the monsoon. You have so much of temperature change, you have humidity, likelihood of viruses, likelihood of gastroenteritis, and likelihood of all sorts of bacterial and viral infections increasing. So, especially the vulnerable, which is the geriatric 60 plus, and the children. People seem to forget that children and adults means the geriatric population, are both susceptible, both vulnerable. And you do not have to only protect the kids or the young ones, you have to protect the adults. So they have to certainly pull up their socks, be on guard, and treat at the first site of infection. More than that, prevent infection.
All right. Always be prepared. That's the motto. At this point, I'd also like to remind the audience that in case they have any questions for Dr. Govitrikar or Dr. Thakur, they can post that in the messages. And as we wrap up the conversations, we'll take a few of those questions and see if we can get an answer from either Dr. Govitrikar or Dr. Thakur. But Dr. Thakur, coming to you, since we are talking of seasonal diseases, how effective is the flu shot, especially for those with chronic conditions like diabetes, heart disease, and asthma?
So I can only say one thing. You've lived with your diabetes, your asthma, and other things. And you've tried your best, and I'm sure you'll try a little more and make your best better to control these things. But you have something with which you can prevent infection, which is easily picked up by you, and that is influenza. And at times like this, with the weather change, influenza is something which is persistent and which is likely to hit you sooner, easier, and harder. So if you can get a shot of influenza vaccine, that vaccine will at least put out that issue out of your mind, or down regulated like the COVID vaccine, where even if you get influenza, which is very common, influenza is a very horrific, scary term. I'll say flu. In my country, everybody understands flu. So if you can down regulate, avoid, prevent, or even see to it that if you get flu, it is of a much milder variety. For those vulnerable sections, the diabetics and the COPDs and the chronic kidney patients, you've done a lot. It's like going out in the rain with one umbrella and a raincoat. That is protection.
Solve the problem you can solve, which you can manage to solve. That's the message there. And I'll take a cue from what you mentioned, which is interesting, which is that, when you say influenza, it scares, but when you say flu, then, kind of the barriers come down. Many adults actually might have forgotten about getting vaccinations, Dr. Thakur, every year against the flu, which gets updated every year. So in your opinion, how do you think awareness can be built to improve the number of people getting flu shots every year?
In our country, unfortunately, the term vaccination applies to only bachus or to children. Grandfathers and grandparents go with their kids for vaccination to hold their hand. Parents go with the little children and toddlers, but they forget that it's the time for the kids to take the seniors. And these are the seniors who have diabetes, chronic kidney disease, COPDs. So vaccination is a term which means prevention. And you vaccinate to prevent the two edges of society: the pediatric, the infants, the toddlers; the geriatric, the aging, the afflicted. And it is these two edges of society which, if you can pick up and prevent, you would have done a lot for society, because then healthcare becomes easier to face, to impart, and to practice.
Absolutely, Dr. Thacker. And my mom, who's 70, she got her flu shot last year and she got her COVID-19 vaccine recently. But do you think that she needs to take the flu shot again? Because that's a question that's being asked even to me many times by my friends to say, hey, we've taken a flu shot, we've taken COVID. Do we still need to repeat the flu shot again?
So when I talk to pretty women like you, I say the same thing. Don't you need to dye your hair every month or every 2 months? Don't you need to remind the immune system every 6 months or a year, depending on what you're using to color? The influenza or the flu shot has to be taken annually. Just because you've taken one doesn't mean you're going to be protected. It's not, unfortunately, like the smallpox vaccination, which if you take one, when we were much younger and I was in medical school, we all said one shot of measles was enough. Now we know we need 2 shots of measles. And all our grandchildren and children going to medical school or going to school overseas all take 2 shots of measles. We also now know that COVID, sooner or later, we'll have to take an annual booster shot. Who knows? But one thing we know, you need an annual influenza shot, because the viruses making up the shot are changing. Northern hemisphere and southern hemisphere, the viruses keep changing. So the WHO is changing the composition. And you need, mangoes have to be bought every year. You can't say, I bought mangoes last year and planted them, now I've had enough. So you need and the timing of the mangoes in our country, which is April, May, and June, is the same as the influenza in our country. So whenever you think of going to buy mangoes, think of the influenza shot and give it to your parents.
I guess you could say for the Aam Aadmi, it's always a good practice to mark a day in your calendar every year to get a flu shot, because as you said, it gets
Aam
updated every
Aadmi,
year.
mango Aadmi, Aam Aadmi.
So the Aam Aadmi has this question, which is that, can the flu shot and the COVID-19 vaccination be taken at the same time? That's a question we hear a lot. What's your view on that? What's the optimal gap between the two?
I think it's a brilliant question. The Aam Aadmi has asked the best question this morning, which means they're thinking, which means they want to prevent. They want to get over their vaccinations quickly. Well, now the CDC has changed their recommendation, and they're even saying you can take both together. But I know from experience and from our previous recommendations, if you keep a 2-week gap, you're better off. For the simple reason, the vaccine goes in, prods the immune system to make antibodies. Now, if you give 2 vaccines, you'll be overburdening the aging or the diseased immune system. Diseased means the diabetic immune system, to produce antibodies for both. So I would say make 2 trips. Go and get your COVID shot, and 2 weeks later, go and get your flu shot. But if you don't have the time, if you're finding it difficult to go twice, you could take it even together. And if you can take it together, you can take it anytime between day 0 and day 14, both the shots.
Right. And having said that, COVID-19 cases fortunately now have seen a dip. But then the new variant, the Delta variant is turning out to be a cause of worry. So what kind of safety protocols are hospitals following these days to make sure that the patients are safe from the pandemic?
Very relevant question, Aditi. You could be vaccinated, but that doesn't mean you're 100% protected, because viruses mutate and variants exist. We are still using double masking in hospitals. When we go to COVID wards, we are using full PPE of the highest degree. We are keeping safe distancing. We are doing hand washing. We are doing sanitization. And we have not changed our behavior at all. And we are still saying COVID is existent. I think what man is trying to do is do the same thing to COVID that we did to influenza. Get to learn to live with it. We are not going to be able to destroy it, dispel it, or dismiss it. So we learn. If you can't beat them, you join them. You live with them. but you down regulate the COVID virus so much that it becomes innocuous. It's like the flu. Most of us, especially the younger lots like you, if you get flu, couple of days and you're done. You don't have to worry. So you'll get to learn to live with COVID. But until that happens, which could be another couple of years, COVID appropriate behavior is of the highest and paramount importance.
Indeed, better be safe than sorry. Now, we spoke about this, Dr. Thakur, earlier, and if you can expand a bit more on, what is your advice for adults in the household, which is parents and grandparents, about the precautions that they should take to be safe in the monsoons?
So I would say again, monsoons, influenza, which is flu, and COVID all put together, along with other hazards of monsoon illnesses. Go out only if you have to. If you get wet, please take measures to repair it. If you need to go out, please go with full protection, not only COVID appropriate, but monsoon appropriate. Don't get wet. Drink boiled water. Eat cooked food. Don't eat stale food or rancid milk. And see to it that if, God forbid, you fall ill, report to the doctor immediately, because they can help you quickly nip things in the bud.
Right. Now, children, we all know how quick they are to get the influenza, and, how the risk of them transmitting this illness is there within the household, because everybody is now started to step out. As much as we don't want to, we see a lot of people going out, and then this does put the children at risk of seasonal infections. So what are the preventive actions that parents should take to protect the health of the entire family?
So I think, parents are the ones which are going to be the drivers of prevention. They will look after their parents and they will look after their children. So both ends of the spectrum, both the generations can be looked after. I'll come to the kids first. See that the vaccination and immunization protocol specific to every disease for them is looked into, whether it is hepatitis, typhoid, flu, most importantly flu, and as and when the protocol for children vaccination against COVID comes in, they should employ it. Coming to their seniors in the house, the same thing. See to it that their vaccination protocol is complete and look at prevention. This is not a time to go out and eat food. This is not a time to shed your fears just because COVID has taken a dip and go into crowded areas. Wear your mask. People with double vaccinations also can get hit by a strain. I'm not trying to scare you, but as Gautam said, better to be safe rather than to be sorry. You can drive the family and make it a happy big family.
Absolutely. And we are also aware that people with diabetes are 3 to 6 times more likely to be hospitalized due to influenza and the risk of death from flu related complications, which is almost 6 times higher in this group. Now, influenza can also aggravate underlying conditions. What do you have to say about this?
Yes, the diabetic, because of his erratic sugars, if he gets influenza, his likelihood of him getting a severe pneumonia is much more than somebody who is not diabetic. Every patient with flu develops respiratory symptoms, but the diabetic's respiratory cough and cold, upper respiratory can go down and become a bad pneumonia. He may need to be hospitalized. And if it's very bad, he can even succumb. One doesn't measure the mortality and morbidity of flu, but if you really tot it up, flu leads to more morbidity, loss of quality hours, loss of working hours, and even mortality all over the world than any other virus put together.
You made a very important point, Dr. Thakur, where you said that the middle-aged folks who are taking care of their parents and who are taking care of their children and are also stepping out to work, they're going to be the drivers of prevention. So adding to my previous question, what are the other precautions that families with high-risk members can take to keep themselves fit and healthy during the pandemic? Because if they have comorbidities as well into the equation, it makes it more risky.
So, you know what? This is where what Aditi said makes a lot of sense. Exercise, eating healthy, taking good amount of sleep, getting vaccinations, taking your medicine, sharpening your medical profile is one thing. But the paramedical care, prevention with masking, raincoats, etc., eating well, eating the right things, and seeing to it that you take adequate amount of rest, sleep, eat immunomodulants, eat healthy, see to it that your vitamin C, that your zinc, and all other vitamins are well pulled up. If you do that, it's a package deal. It's like when you are going out, you pack everything from toothbrush, toothpaste, to socks, to your medicines, and you see to it that it's all complete. It's a complete package. You can't go in bits and pieces.
So that visual mnemonic helps for folks who are watching, and we have covered a diverse range of topics within this discussion of how folks can stay safe in these times when there's monsoon, there's fears of the flu as well. So before we go into audience questions, Dr. Govitragar, what would be your message to our viewers about keeping themselves healthy in this fight against the flu?
So, what I would say is to keep yourself healthy, look at yourself as a holistic being. So, start looking at your own physical health as well as mental health. Because, being again a mental health professional, I'm aware that how stress can play a role towards your immune system, and stress decreases or doesn't allow your immune system to function optimally. So start looking at your mental health as well. Where physical health is concerned, I'm just going to add a few points to what Dr. Hemant said, is that exercise plays a very, very big role. So start exercising, even if it is just for 15 minutes, half an hour, climbing upstairs, these kind of activities, not sitting for a long time. Like I say, that sitting is the new smoking. It is as damaging to your physical health as smoking is. So get up. If you're working at from home, one tends to sit for hours on your chair. So start getting up and walk around for 5 minutes. That will keep your health going. And be aware. If you're not vaccinated, please go ahead. It's a matter of half an hour, but you will be protected, and that will help you. It's like your soldiers, right? You're getting your army ready in case there is an attack. You have it all healthy and optimally functioning. So start looking at yourself, start becoming aware of what is the requirement, if you need to lose weight, if you need to tone up, or if you need to take your vaccines. Go ahead and start taking those steps. Those will definitely help you in this fight against the flu.
Absolutely, take care of yourself and take care of your body, and and when you live healthy, it'll influence others as well. That's the message coming out. On that note, let's get in a few questions from the audience and see what they have to ask. Our first question comes from Sohini, and she says that her mother is undergoing dialysis and she is susceptible to flu and cold. So in such cases, will the flu vaccine help and protect her? Dr. Thakur, you want to take this?
She must give it to her mother. Not only will it help and protect, it will go a long way. She's already fighting her kidney issue. They don't want to open up another war front. Look after the kidney with what you're doing, but prevent the flu with the shot. Must take it.
All right. Another question comes in from our audience, and the question is that what about working adults, 35 plus, who have to step out for work? What's your opinion on them taking the flu shot? We discussed this in detail, but if you could recap your answer towards that specific audience question, some words of
I think,
advice.
again, the question is very well founded. Since our spotlight has been on pediatrics and geriatrics, people think the vaccination is not for the working 30 to 45 middle-aged people. I'll now shift the stage to the West. If you go to New York, or if you go to America or England, once the flu shot and the flu season starts, there are signboards put everywhere. Have you taken your shot? Please go round the corner. Please take it. If anybody can get flu, so if you want to protect yourself, you lose nothing. You have everything to gain. get your flu shot. It doesn't hurt, it has no side effects, and it'll lend you protection. Of course, it lends more protection to the bachus and to the seniors, but it gives protection to you too. You are going out, you are in the crowded train, you are in the packed offices, you are going to football and cricket games. You should be as protected, because if you are ill, you'll bring the virus home. And once you bring the
Mm.
virus home, you will give it to the others. So everybody should be protected. As Aditi said, we're all going to war. One person cannot say, I'm minding the store, let the people go in front. Everybody has to be protected. Please take your flu shot.
I can actually visualize a poster of Uncle Sam pointing a finger at someone and saying, I want you to take the vaccine. The next question comes for Dr. Govitrikar. How do you balance it out at home and with your child? So, what's your word of advice for them, Aditi?
Yeah, that again comes to awareness. The fact that, yes, I need to have some time for myself to begin with. And that's a very crucial point, because our social conditioning is such that we are taught to not look at ourselves and do things for others constantly. So when I became aware of that, I started carving out time for myself, because I realized that if I am healthy, if I'm happy, I make a much better mother. So that is what I have started doing. And I teach them that as well, that self-care plays a very, very big role. If you want to eat something that is not good for you, it is going to have an effect on your body. So that kind of awareness helps me when I follow it. So I walk the talk. I demonstrate it to them, and that is how it becomes easier. And since now school is from home, my work pretty much is at home, I consider that as a boon, because it helps me stay in touch with them a lot more than when things were different, when I was traveling or when they were at school and they used to go out for classes. So instead of saying that, oh my God, I'm working from home, or oh my God, school, I've started looking at it in a positive light to say, how can I make the best of what is available to me right now? So I'm utilizing this time so that there's a proper balance. We speak every day, we have a meditation hour, like I said. I also want to start a reading hour, because that is something that is very close to my heart. So there is certain time that I allocate to work, that time is allocated to them to do their work, their homework, etc., their assignments, and then the rest of the time we pretty much spend together.
That's a great approach to that point of maintaining the balance. It's about yourself, it's about loving yourself as well, and of course having the time to take care of your family, but self-care is also very important. Great point.
Absolutely.
Then next question coming in from Rajinder Kapoor: can the COVID vaccine replace the pneumonia vaccine, or do they both need to be taken separately, and why? And in addition to that question is, why is it that the polio vaccine or the measles vaccine, they need not be taken annually, and how does the body remember to fight against these viruses? What's your view on this, Dr. Thakur?
So the polio vaccine and the measles vaccine are usually single vaccines. Measles is two, because the amount of immunity that those vaccines create are lifelong immunities, because the antibody production is of that nature. Now, can a COVID vaccine replace a pneumonia vaccine? No. The COVID vaccine is against the COVID virus. Pneumonia vaccine is against the pneumonia bacterium. So they are discrete vaccines. Whether they can be taken together, again, the thinking is try and separate them by 5 to 7 days, because the antigen antibody reaction should not be multiple. But if you have no choice, do a minimum of 3 days. Compared to that, flu vaccine, you can do simultaneously. Both are viral vaccines, but try and segregate them. I'm afraid you have to take all the vaccines. You can't say I'm putting sugar, I don't need to put salt, because these are two different things. Just because you're taking the COVID vaccine, you can't escape to take the pneumonia vaccine.
Okay, one more question comes in from Saghir Asad, and the question is, what precautions can an ophthalmologist take in his clinic, as he has to be very close to the patient while examining the patient, and should an ophthalmologist stop attending their clinics? A very important question. What do the doctors themselves do? So, how would you approach this, Dr. Thakur?
So you have to primarily see that you are vaccinated. Once you are vaccinated, And as Aditi said, look after yourself first. Wear your mask first. Now, besides your vaccination, you have to double mask. You have to probably wear a visor or a face shield because you're going to get close to the patient. And then when you are facing the opposite party, encourage your patients to be vaccinated. If they have not been vaccinated, see to it that they are double masked. They also wear visors. Try and treat them remotely, but if you have to see them personally, encourage them for all the hygiene and precautions that you have to. By and large, before Diwali this year, most of the people who need attention should have at least got one shot done. Because if they need attention to go to an ophthalmologist, I will not blame the ophthalmologist if they say, please come after vaccination. It's a question of life and death, and we all need to take precautions. But as an ophthalmologist, please double mask, please wear visors, and I'm assuming you've been wise enough and you've taken your shots. Observe precautions in your clinic. Have a ventilation where the air conditioner is uniflow laminar and you have an outward flow so you don't recirculate the air.
All right, let me take in the last question from the audience, which is that with the unlock happening across states, people have started to go out. So, will the flu vaccine help to fight in this monsoon the variety of diseases? And is there any particular time of the year when one should take the flu vaccine, or can it be taken at any point in time? The last question, Dr. Thakur.
Yes, usually the vaccines are dictated by WHO as Northern Hemisphere and Southern Hemisphere vaccines. The vaccine timing in our country is from April to September for the susceptible season. So you must take your vaccine. There is data emerging that if you take the flu vaccine, you will also get some protection against COVID, because both are viruses, both hit the respiratory system, but we are still collecting their data. One vaccine cannot supplant the other. You can't say I've taken COVID, so I don't need flu, and vice versa, but you must take it. Monsoon time, it's July. If you haven't taken it, after this show, make an appointment, go and take it. It's simple, it's easy, and one of the best vaccines in the world. The Quadri vaccine is available. Sanofi makes this vaccine. We give it, I have taken it, and we give it to all our patients, and excellent results have evolved.
All right. On that note, let's wrap up this conversation. Thank you very much, Dr. Govitrikar and Dr. Thakur, for joining us in this discussion today and sharing with all of us your views and insights. And I'd also like to thank all those who have tuned into the special presentation for also asking your questions, which I hope we have answered to the best of our abilities. With all the focus on the COVID-19 vaccine, let us make sure that we are vaccinated against the other pathogens lurking out there. It is time to step up the precautions and take the flu shot to keep our loved ones safe during the pandemic, especially with the onset of the rains. That's the message coming out there. I'd also like to thank Sanofi Pasteur again for partnering in this initiative. If you require more information on protection from the flu, you could visit the website that you can see on the screen and get more information. More information will always help you. Remember, knowledge is power. But on that note, this is Gautam Srinivasan signing off. Have a great day.